Srihan, and a happy New Year. Happy New Year. Happy and healthy to all of us. Yeah. So this year, in the very first class, we're starting with a new drug, and that is arsenicum album. Arsenicum album is very often used in our clinical practice. Very often. Okay? And almost all of us, even if you're a first year practitioner or a student who's doing internship, we have all used arsenicum, either on ourselves, on our family members, or on our patients. So, what happens is that if you look at a drug like arsenicum, and you look at the records of proving, we have thousands of symptoms which are there in provings or as clinical symptoms. But what usually happens is that our scope of use of the remedy is restricted to a very few symptoms that we either read very often because of the experiences of others, or we call them because of our experiences in our practice. And this is called bias in prescribing. Okay? I'll give you an example. So, about 2 weeks back is a student of mine who's also a doctor and is practicing in Europe, and he called me, and his mom, who's about 60 years old, and she went out for trekking, and she goes for trekking quite regularly. So she went on a trek, and it was a 2-day constant trek, short one of a short duration, not very high mountain, but it was a short mountain. Went on a trek and came back. So they went up one day, camped overnight, and came back the following day. When she came, she had terrible pain in legs. She could not sleep at night. And so in the middle of night also she was getting up and she was walking. And when she would walk, she would feel better. And the moment she would get in bed, she would be worse again. And if she would put a hot water bag, she was better. And the moment, the bag would turn cold is when it would become worse again. And then again she would get up and she would walk. And this is how 3 nights went by. So the remedy was very obvious. Restox. So the doctor also gave Restox. So gave a 200, then a 1M, then gave a 10M, and desperation even gave us a CM. But there was absolutely no relief. Absolutely no relief. When the mother was walking around during the day, she was relatively okay, but at night when she would get in bed, and this is when symptoms would become worse, and there was any way of cold wave going on there. So that's when he connected with me. This is how it is happening. I have given Restox, but it is not working. I said, okay, let me speak to your mom. So I spoke to mom, and she explained the entire same thing to me. I said, what really happens when you go to bed at night? She says, I have very sharp pains, and I have no choice but to get up. And when I walk, I'm better. But the moment I lie down, it gets very bad. So I said, is there anything else that you experience? She said, no, it is only pain. And the remedy, my friends, is arsenicum album. How do you differentiate between arsenicum album and Restox? Restox, with that pain, will also have stiffness. And that stiffness was absolutely missing in this patient. Both arsenicum and Restox have pain from overexertion. Both of them. And they are excellent remedies remedies for ailments from overexertion. Okay, both of them have aggravation at night and at rest and are better by walking. Both are better by warmth. What is the distinguishing factor is the stiffness. Russ Stokes will always say my body becomes stiff and sore when I go to rest or when I wake up. And when I start walking, that stiffness and soreness and pain goes away. What she was complaining of was only excessive sharp pain. That was the differentiating feature. And first dose of 200, and I told him specifically something which I learned from Dr. Khan in these kind of pains, a drop of the medicine direct on tongue. So I asked him, one drop of arsenicum 200 on tongue now. And 15 minutes later he called back, she said, did you give me a painkiller? It worked that fast. So, next day we gave a dose of 1 and the following day 10 and everything just disappeared. So,
and why not tongue? One drop, why not it?
It is purely empirical. I learned that way from him. He gave 1 dose directly on tongue and that kind of sharp pain. It works like a charm. Sometimes in intense pain, I've always seen a drop directly on tongue works very fast and instantly.
Probably because of nerves.
I don't know. That would be, guessing what really happens. I believe as a clinician, my role is just to give the medicine, and how it works, how it doesn't work, is something I leave to the researchers and the scientists. So I don't disregard their work, but basically this is what I've learned, and that's my field to treat patients. So minor differentiation and a complete different remedy. So that is first case that I wanted to share with you, and how we need to minutely differentiate between remedies. Homeopathy is all about differentiation between remedies, and the more carefully you do that, the better outcome. Right. So now when we study arsenicum, I'd like to just try to focus on the modalities of arsenicum. What makes it better and what makes the patient worse. So what do we call as the modalities which are better or worse? We'll start with Alpi. Sorry? Okay, head symptoms. So just one. After next. Aggravation from? Okay.
Ailments from
Okay. What else? Better by warmth. Okay. Yes. Aggravation especially. Also.
So relief by warmth.
Better by hot or
burst from cold drinks, fruit, ice cream, stomach
yes. From cold drinks,
fruit and ice cream.
fruits.
Respiratory symptoms aggravation by lying down.
Relief by is better sitting up. Yes.
The regular Aggravation, wet weather. Aggravation, wet weather.
Wet weather. Okay.
And she's
So,
sure.
damp and cold aggravates. So, basements and all, or cellars, they make them worse. What else?
Complaint was thinking about them.
Okay, so yes, sometimes it may happen, but it's not that marked the modality of arsenic. What else? What else? And modalities. What else?
Imagination open air.
Open name is Savachana.
Headache relieved by cold others.
He wants everything
Okay.
windows and
What else? What are the modalities? What else?
stomach symptoms.
Burning relieved by warm.
Burning relieved by warm. So that's better by hot. So that's a kind of a pain or anywhere you have a burning sensation, that's better by hot. What else? What else can you think
Stomach
of?
symptoms better by sweet milk.
Uh,
Condensed milk.
What else? Has definite modalities. Okay? Now remember, that's midnight. So now what happens is, it is a remedy which is burst by cold air. We said cold drinks, fruits, ice creams, also ices. It's one of the strong remedies which is worse by intake of ice.
Shield from being overheated.
Icy cold drinks. Okay, also, you have to keep in mind, it is a remedy which is worse from decayed meat. It's an excellent remedy for that. Okay? Any kind of decayed meat. Then it has aggravation from fish, especially. What will fish intake cause to few arsenicum patients? It will lead to formation of itis after fish. It's almost a singular remedy for that kind.
So there is ailments from decayed meat as well, or is it just the aggravation?
So aggravation always translates as
Ailment.
okay. When we say aggravation translates as this, but it is not vice versa. Always. Okay? Now, another thing. What else makes it worse? Vegetables are also one of the aggravation factors of arsenicum. They are said to be more meat eaters.
मेलन भी एग्रीवेट करते हैं मेलन.
हाँ, कुछ क्लिनिकल सिम्टम ऐड करेंगे बाद में, बट इन जनरल vegetables and cold fruits, any kind of a cold fruit, especially which has been refrigerated, when you take it out, you have it and you fall in. Arsenicum is one of the important remedies. Okay? What else is marked besides midday is the periodicity. Okay? So what kind of a periodicity does it have? There is yearly aggravation. Okay? And what is also singular to arsenicum is a 14-day aggravation. Every 14 days it gets worse. So there are a few remedies, like sulfur is worse 7 days. Arsenicum is worse 14 days. Which remedy is worse 21 days? Magnesia. Magca. Worse 21 days. Just keep that in mind. These are all singular symptoms. Okay? What else will make it worse? Can you think of anything else?
So processed food or processed meat.
मतलब yes, it can be one of it. So basically it is decay. Decay. Okay. What else makes arsenicum worse? One more important modality. Yes. Yes. It's, yes. Exactly. Alcoholism also makes it worse. One of the olden terminologies for alcoholism is when somebody takes too much and too often an alcohol. There's an olden terminology, it's called tippling. Or, दूसरा ने बताया, diplomacy. Okay? So, these are very important modalities. And there's one thing that you must always remember. Okay? Also another aggravating modality or ailments from, and that is from eruptions suppressed or undeveloped. Arsenicum is also one of the prominent remedies. Whenever any internal disease alternates with skin symptoms, arsenicum is also one of the foremost remedies. Also one of the foremost remedies. Okay, you have to keep that in mind. So, remember, Allen's keynotes mentions very few remedies in these. Arsenicum is one of them. Okay? He writes asthma alternating with skin complaints. But any kind of internal disease that alternates skin complaints, arsenicum can be an important remedy for that. Okay? Now, can you think of any other symptom of modality which makes arsenicum better?
Sipping water.
Yes. Small and frequent water. What kind of water?
Warm water. Cold.
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 Okay. So, better by heat. He is always better by dry heat. Always better by dry heat. You have to keep that in mind. Better by moist heat. Episode. Better by dry heat. Arsenicum. Okay. Also better by hot drinks. Also better by hot drinks. You have severe pain in throat, better by hot drinks. Okay?
Sir, moist heat कौन सी होगी?
Steam.
Okay? So hot drinks, hot wraps, hot dry heat, hot food, they all ameliorate arsenicum. Okay? And what else?
So lying with elevated head.
Yes, very important remedy. Elevated head. Very important remedy. One more modality you should never forget. Better by 3 plus, better by perspiration. All symptoms are better by perspiration. All symptoms. So during a phase of fever, the moment sweat happens, all symptoms disappear. And that is singular to arsenicum. Okay? Now,
So in case of anxiety, if the patient says, I sweat profusely like anything, can we think of it?
if he feels better by perspiration, then yes. A few other remedies for that in symptoms of mind, but for arsenicum, it's a very, so one of them is arsenicum, but yeah, it's a very important symptom for arsenicum album. Now, we all know what kind of a thirst does arsenicum have. Small,
frequent.
Can you tell me one condition where arsenicum can be thirstless? Not what head says. A state or a symptom where arsenicum is thirstless. During a stage of chill, arsenicum patient is almost as a rule thirstless. But if they would want water, they would only want it okay? So remember this always. So these are all gold benefits of this. Okay? So how would you want hot water? Oh, sip. That's it. Okay? Are we clear?
Yes, sir.
Okay? So this is a few of the modalities of arsenical amalgam.
Understood.
I need something to clean.
Yes, sir. I'm sorry to ask. Kaushik sir.
So before we go further to study our symptom from from the Farrington's clinical media, I would just like you to just try and remember the symptoms of mind of arsenicum that you know. Okay? Symptoms of mind of arsenicum. Okay? So, anybody.